Okay, welcome back, everybody. Here we are in a series of another great talk by Dr. Ed Weisbart. He is the National Board Secretary and Missouri Chapter Chair of Physicians for National Health Program, a nonpartisan nonprofit organization that supports single payer. Dr. Weisbart is a retired family medicine physician who practiced for over 20 years at Rush Medical Center in Chicago, where he moved to St. Louis, where he served as the Chief Medical Officer of Express Scripts. During that time, he also volunteered as an assistant professor of clinical medicine at Washington University in St. Louis, and also as the president of the Consumer Councils of Missouri. Thank you very much again for coming in, Dr. Weisbart, and we look forward to this unique talk on lessons from a red state.
Thanks, Hamza, and hi, folks. Today we're going to talk about how to talk about talking about stuff. So this topic is near and dear to me because I grew up in Chicago and I trained in Michigan and spent most of my life there. And then I moved to Missouri and to St. Louis and discovered that so many of my preconceptions and insights into how people who think differently than I do were just wrong. I had a completely wrong-headed perspective on folks with whom I disagreed. And since living in Missouri, much more closely related to people with whom I disagree, I've discovered far more respect for people's points of view other than my own. And I realize how, frankly, inadvertently insulting many of the things that I perhaps used to think, and certainly maybe even say, were, and how not only how inappropriate that can be, but how counterproductive it is to be thinking that way. So I think I've given hundreds of talks about healthcare reform issues, and when I started doing them in Missouri, it struck me that I needed to understand my audience. I needed to understand the people with whom I'm communicating much more than I did. And so I started reading and modifying the way I would describe things, not the content, not the core, things I wanted to communicate, but I started figuring out how to frame things differently based on evidence. So my goal today is to share with you some evidence, some information, some models of how to think about communicating. And, we're going to use single payer as sort of the MacGuffin topic of a thing that we want to communicate about. But to be frank, I hope that the things we're going to talk about today have resonance way beyond just way outside of the one particular issue. I hope that if you're coming to this discussion from a conservative point of view, you'll find this helps you learn ways to communicate that point of view with progressives more effectively. And likewise, if you're coming to this discussion from a progressive point of view, you'll learn how to communicate that more effectively, and not just on politics, more broad than that. So that's kind of the run of show. Is that what you all were hoping or expecting to hear for the next chunk of time? Good. Heads nodding. Good. Always a good thing. So let me get some slides going, because as I've told you before, I dream in PowerPoint sometimes. So PowerPoint, here we go. Okay, and I know you can see those. So that's basically what we're going to be talking about today. One of the perhaps entry points for me that really kind of shocked me was a few years ago, more exactly when, a group of us were volunteering with, what's the name of the group? I can't remember the name of the organization, but they were testing out the idea of communicating door to door in a different style, communicating in a way that was a learning from marriage equality, that rather than sort of dropping a leaflet on somebody's door, actually have conversations and sit down and talk with folks about what they thought. And so we were trying to find the most conservative area because most of us were coming from a progressive point of view. We were trying to find the most conservative area around St. Louis. And you can find that, there's information about that. So within 2 hours. So we went to the most conservative area that we could find, and looked for the most conservative house we could find, or I looked at the most conservative house I could find. And I came upon this house, and I was pretty sure that I didn't agree with them about some things. It's not actually their house. I wasn't smart enough to take a picture of it, but the house that looked very much like this. Yeah, I was pretty confident that that wasn't that we would have some disagreements philosophically about this. So I went to the door and I knocked on the door, and the woman answers, and we start talking for, I don't know, about 10 minutes in, and I wish I had recorded this conversation, but I didn't. And she finally says to me, she said, I go to I look on the TV and I see people from Canada and England, and they're all skinny. But then I go to the Walmart and everybody's fat like me, she said. And she said, why don't we just do what they're doing in Canada or England for their health care? I thought, oh, really? I didn't prompt that at all. And I wish I had taken it. That got me really kind of thinking that these disagreements that we seem to think of as immutable are sort of a veneer, just a veneer over actually our humanity, and that there's a lot more in common than the TV machines would have us thinking. Kind of put me further down the road. And here's one of the first sociologists who kind of studied this, I think, in a serious way. And I recommend her book to you. She embedded herself in oil-rich parts of Louisiana and wanted to really understand why it seemed to her that people were voting against their best interests, why it was that low-income folks were so often voting against their own best interests. And she came up with two frames. She said liberals and conservatives each have deep narratives in their head. And she said the first one, the liberal deep narrative, she said, is that we've built this public square. We're proud of it. We built this, it's a metaphor, of course. We built this square and we're proud of it. But we see marauders at the gate invading our beautiful public square and dismantling it, taking our bricks that we constructed to build their McMansions. That's how liberals think in her mind, that this deep narrative that there are marauders dismantling our public square that we built. Conservatives have a different mindset, she said, and she said that they're waiting in line for the American dream, and that they're proud of the fact that they're waiting in line. They're proud that there's a sense of personal value in the idea that they can wait patiently, but that they're angry because the line just isn't moving. They've been waiting in this line with pride, and yet the line isn't moving. And so their point of view is that what they see the government, the reason the line isn't moving is they see government escorting the line cutters to the head of the line. She thinks everybody should be able to get to the head of the line and get the American dream, but get in line where you belong, and government shouldn't be escorting line cutters. Deep narratives. So she said, while economic self-interest is never entirely absent, these deep narratives are important. She describes the importance of emotional self-interest, even way beyond economic self-interest. And we're going to try to make that a lot more real and pragmatic of a lesson as we walk through other examples. So the first is the notion of moral tribes, of tribes. And this is the best source, I think, to read this. He sort of unpacked this quite well. And he said that tribes undergird morality and politics. So that's, of course, the aisle that's seldom crossed in Congress, or the differences from in a boardroom. The boardroom sort of establishes its own tribe. And and that these tribes are based on evolution. The idea of tribalism is based on evolution, that you want to protect your own. People who evolved as individual lone rangers often didn't survive as well. So there was a genetic pressure, or an evolutionary pressure towards having people cluster together to raise food, to hunt and gather and do all that, and to protect the food that you raised from the food that some other tribe is raising. So that over millennia, this idea of protecting your own tribe and warding off against other tribes is became important and is part of who we are genetically. And we will show some practical lessons of that as we go through this. But tribalism is a big deal, and it's even more so than it was, I think, when Green wrote this book. Okay, want to do a little experiment to kind of unpack another one of these little models, and I need a volunteer. Who's willing to volunteer? So I guess raise your hand so you get to the top of the group. Let me maybe stop even sharing for a moment so I can see who wants to be my volunteer. Okay, Kaya. How do you pronounce it, Kaya? Okay.
No, you got it, Kaya.
I didn't hear you.
Oh, sorry, Kaya.
Oh, God darn it, my speakers. I hate my speakers. I can get that to work again.
I mean, it might not help that
Okay.
my cat's lying on my computer. So.
There we go. Now I can hear you. Yeah.
Perfect.
Okay, so we're going to play a game, and just one round of the game, and the game is and I'll put my screen share back on, but I'll keep you on the top. So the game is we're going to toss a coin, and heads you lose $100, but tails you win something, some dollar amount. Heads you lose $100, and you have to pay me $100, and I take Venmo, so you pay me. Tails, you would win something. So how much does tails have to be worth for you to be willing to actually engage in this game? Were we in the room? You understand the rules? How much does tails have to be worth for you to say you'll play?
Probably the same amount I'd lose.
You go for 100. So if I were there and we were going to toss one round of coin toss, you would play for $100, win or lose.
Yeah.
Okay. Anybody else? We're open to other takers now. Anybody else would want to play with a different dollar amount? Hamza.
200.
200. And we'll take one more better. Anybody else?
I think it would have to be really high. It would have to be like 1,000 or something.
1,000. So interestingly, I've done this game pre-COVID in person in rooms of 100 people many times for different topics. And one guy actually said $68. I'm not making that up. He said $68. So, I felt like stopping the discussion, stopping the presentation, and walking off to another room with him and playing all day. But I didn't. But I don't think he understood the rules, and you caught on more quickly. Okay, so interesting answers. The normal answer, or the average answer around the world is $200. And that's been tested in all kinds of cultures, in non-financial cultures, in cultures where they barter with goats and sheep. It's 2 to 1. Losses count twice as much as gains. So, Kai, you're unusual, but that's good.
Because I have younger siblings. That's it. Everything has to be fair.
That makes a lot of sense. So losses in general, the message here is that losses count twice as much as gains. Okay, let's make this a little bit more, relevant to why you're here. So when we present messages, now that was data, actually, there's a ton of data. Now we'll take a leap of faith, and we'll do that several times today. So the leap of faith is that when we talk about things like Medicare for All as a MacGuffin topic, we can focus either on a gain-centric message or on a loss-centric message. So we tend to do gain-centric messages, right? We tend to say, with Medicare for All, you'll save money for the things that you want. A loss-centric message would be stop wasting your money. And I would submit to you that if you're going to make the argument about this, a loss-centric stop wasting your money is roughly twice as potent, takes you no longer, but it's twice as potent as the gain-centric message. Gain-centric message with Medicare for All, you can see any doctor you want. Loss-centric messages, they are taking away your choice of doctor. Don't let them do that. It feels more powerful, doesn't it? Doesn't it feel more powerful? Gain-centric message, you can live longer and healthier. Loss-centric, you're dying younger than you need to. So gain-centric messages, loss-centric messages, be thoughtful about which you choose when you do it. So one of the sort of core models I want to unpack with you is from this guy, George Lakoff, a neurolinguist from Stanford, who really influenced the way I think was sort of the first aha moment for me. And he has this tome called Moral Politics. It's I don't know, that thick. It's a tome. The first half of it is just about the neurolinguistics of morality, and it doesn't take a political point of view. The second half explains why his point of view is right and everybody else is wrong. But the first half is just about neurolinguistics. And I've given this book to half a dozen of my conservative friends, and they have validated to me consistently that his description of how conservative minds work is how they work. Their minds work. So it's a pretty good book if you want to understand this stuff. He wrote a much simpler version of his book called Don't Think of an Elephant, if you want to read something that's, a couple of hours rather than a couple of weeks. But in it, he says, when you're arguing against the other side, don't use their language. If you use their language, you've already lost, because language picks out a frame, and the frame may not be the one that you want. So his model that he came up with, he has these two cognitive models. And these are his words: nurturant parent, or the strict father. He used to call it nurturant mother, and he revised the nurturant parent, but still he has this. These are his words now: nurturant parent versus strict father. And he said, where you fall on one of those two models and how these models get established is largely based on how you were brought up and how you were, where you are in the birth order and all of that stuff. So Kai, I think we know where you fell on this, and I think your answer of why explained that. So he said that we're usually one or the other. Nurturant parents are tend to favor equality, tend to favor diversity, and support the idea of a helping hand. The next Beethoven might be out there, so help everybody up. That's the nurturant parent model, and that's basically people who tend to be liberal. Strict fathers tend to think hierarchically and instill hierarchic minds or things in your head. And the hierarchy is very explicit, he says. The hierarchy is, if I can reproduce this right: God, man, woman, child, animal, plant, rock. With then variations within there for race and all sorts of other things. But he says that there's the strict hierarchy, and that where you fall on the hierarchy reflects your morality, your moral integrity, and that and basically it's the belief in social Darwinism model. And inherent to this idea of the strict father is that the hierarchy is protected by consequences, that you have to have consequences for your actions, and a social system that robs you of those consequences is dangerous. And this is basically conservatives. So I lived this experience with when I was advocating here in Missouri for Medicaid expansion, and I went to our state legislature, and our one of our my state senator at the time was just all against Medicaid expansion, and I met with him privately then and talked to him, and he said that Medicaid expansion wouldn't save lives. We shouldn't expand Medicaid. It doesn't even save lives, it just costs money. So I met with him in the coffee shop for 45 minutes. He was nice enough to do that. And I persuaded him that indeed Medicaid expansion would save many lives, even in Missouri. Persuaded him of that. And finally he said, okay, doctor, you persuaded me. I believe that, and that's fine. I still don't support Medicaid expansion, because he said, and this is not a direct quote, but close to a direct quote, he said that expanding Medicaid would make it easier to thrive and survive as a low-income, morally derelict person. And so if we expand Medicaid and help that group of people survive, maybe we'll have fewer deaths, but we'll have way more eventually because of the collapse of society and civilization. That's how he thought. And he was Jesuit. I mean, he was faith-based. But that is how he thought. I will give him credit, because never in the rest of his term in the legislature did he say that it wouldn't save lives. So he did actually hear and accept what I said, but he had this other concept. So this is real. There are people who can buy our facts about saving lives, but for whom that's not the bigger issue. It's this morality. The key from Lakoff, in my mind, is that he said that there's this other group that have both of these frames in their heads. Both frames are active. They look like they're undecided. They look like they're independent, but they actually generally have both frames. So what do you do with this? I'm going to make this practical in just a moment. The interesting data from him is that he said 20% of Americans only have the nurturant parent model in their head. So if you try to talk to them about the strict father messaging, they won't even hear you. And I know people like that. When you try to deliver strict father type messages, it's just, why are conservatives saying that? I don't get it. And likewise, he said 20% of people have only the strict father and can't hear, literally can't hear. There's nothing in their brain for the nurturant parent messages to land on. It doesn't land. But that 60%, do the math, have both models in their head. Really interesting. So our job is to try to activate the nurturing side when we're getting places. That's what I thought. So I've kind of put together some things you can do with this. So when you're talking to liberals who have only the nurturant model in their head, I think the mission when you're talking to a really liberal audience that doesn't even have the conservative strict father model in their head is to at least help them understand where the landmines are. And I'll show you more about that in a few moments with the next model, but help them understand how they are inadvertently angering and insulting and alienating and shutting down many people that they're trying to reach. So help them at least understand that. And then the other piece you can do with when you're talking to a pure liberal audience is try to engage them and move them from perspective into commitment and actually action. So when you identify somebody of that mindset, that's where I go. So one of the things I do when I'm listening to somebody talk to me is, when somebody's giving me their point of view or they raise a question in a room, I try to pigeonhole where they are in these three buckets. And if they're in this third bucket, the purely liberal, non-crossover group, then I try to go towards these messages. Then there's the other extreme group, conservatives. And before I gave this enough thought, I used to say, if you identify somebody in this group, the 20% of people who only have this mindset, I used to say, just walk away. There's no point in talking. You're not going to get anywhere. And that's just really not true. That was naive and insulting of me. So what are the values? Liberty, consequence, and prudence. Actually, who here does not have some value of liberty and consequences and prudence? We all, to some degree. So with this group, when you find you're talking to a conservative group that doesn't have any of the liberal mindset, there you should talk about the things that resonate, about losing your choice of doctor, or talk about, very, very few people will say that if you can't afford insulin, you should just die. Very few people, it's not 20%, it's much, much fewer. Very few, the United States decided that if you're end-stage renal disease and you need dialysis or you're going to die, the United States decided in the 1980s that needing dialysis for end-stage renal disease was a criterion for getting into Medicare. So other than people from the Marshall Islands, everybody, and that's a whole other topic if you want to talk about it, other than them, if you're a citizen, you can, and you're on Medicare or you're a citizen, you can get into Medicare if you need dialysis and not have to pay for it. Okay, so we all pay for dialysis. So if we're going to all pay for dialysis, and then wouldn't it make more sense to prevent the need for dialysis? And the answer is almost always yes. Most people would agree with that. So when people recognize, when you talk to somebody and say, no, if you can't afford dialysis, you should just die. Well, okay, that group you can walk away from. But nobody says that. Very few, very, very few people, I'd say less than 5% say that. So if you buy dialysis, it's just more prudent to buy insulin or to buy hydrochlorothiazide or whatever. So that's an argument that seems to resonate. As long as we're in, let's do it. Let's be prudent about it. And then the other argument that resonates, with purely conservatives is that it's Medicare, not Medicare Advantage or commercial insurance companies, that really gives you the control over your healthcare. With independents, the message here is that we want to try to activate that nurturing part of their brain, right? Because they have both themes in their head. And so if you recognize that somebody is not in either extreme, what you want to do is early in your discussions, activate the nurturing part of their head. That's where stories, narratives, a personal story from your life, or get a story out of them about somebody they want to take care of. And then, of course, you don't want to stop there. You want to try to make the relevance of that story to their policies. And I think I gave some examples of that during the public speaking talk that we gave. Okay, that takes us to what I think of as George Lakoff 2.0. And I like thinking of it that way because I believe that's insulting to both George Lakoff and to Jonathan Haidt, the next piece. So equal opportunity insulter. And he wrote this great book and has done great research. This book, the pivotal book in my mind, is this thing called The Righteous Mind, which is now 10 years old or so. And he's updated a lot of information from it. And I'll be showing you some of the updated information. But the book started with an online survey of 130,000 people. And from these surveys, he identified what he calls 5 moral pillars. So he identified these pillars. He gave you score based on the surveys. He scored you on the pillars, and he likewise identified where you were on the political spectrum, from very conservative to very liberal. And there are patterns that have emerged about this that identified. First, the moral pillars in the book and his online stuff. There's pages and pages and pages describing each one of these moral pillars, and I'm not going to do that to you because the words are pretty close to right. One of the moral pillars is of fairness, and that's not cheating, fairness versus cheating. So fairness means reciprocity, means valuing equality, and that rules should be based on objectivity, not based on nepotism or what have you. So fairness. A second moral pillar is caring, empathy, and not hurting people, separate and distinct from the fairness metric. Sanctity, not degradation, and he links these to these other things. Authority, not subversion. So obedience, respecting hierarchies, respecting traditions, both social and other traditions. And then lastly, loyalty. And this is loyalty and not betrayal. Loyalty, and a big writ large, is patriotism or loyalty to your social group. So these are moral pillars that he identified, and it has a way of actually measuring and quantifying. So it's interesting when you start looking at liberals versus conservatives. So here's the score that liberals get on his chart. And you notice that, not surprisingly, liberals, and this is the extreme, but the groups of liberals tend to score very high on caring and fairness, and don't tend to score anywhere near as high on these other values, as you can see. Interesting. Whereas conservatives have a very different pattern, and there's moderates that fall in between. There's data on that too. But conservatives and liberals score very differently on these moral pillars. So if you're over here all the way to the left, looking at somebody to the right, you see a lower score on caring and fairness. You see a lower score than you have on caring and fairness, and you just think, I have the monopoly on caring and fairness, and you don't. Whereas if you're all the way over on the right, looking to the left, you see, okay, you've got those 2 moral pillars, but what about these other things that are core to my morality? You reject those almost, and your lack of morals will destroy our society. That's almost exactly what that state representative said to me. The reason I'm showing you this is because we're both right and wrong, right? My message here is that both sides have a firm personal morality that tells them that they hold the moral high ground and that the other side does not. Both sides say, we've got morality here and you don't. And so that's the foundation for how we insult each other without even thinking about it. So to use our MacGuffin here of Medicare for All. So fairness in Medicare for All means healthcare is a human right, and I used to open my presentations to, when I was talking to grand rounds or whatever, and the first thing I would say is, hey, we all agree, right? Healthcare is a human right. Now let's just figure out how to make that happen. Well, that was really stupid. That was really stupid because there isn't consensus about that. And so if you're talking to a very liberal audience, sure, that sort of motivates, activates, taps into that. But unless you want to have a 15-minute discussion about the definition of a human right, you're going to be off topic with that. Caring, this is the idea of protecting the vulnerable. Again, that's a part of the Medicare for All messaging. But these arguments, if you open with these and emphasize these to conservatives, you're going to be shooting yourself in the foot. Here's just an example of what we sometimes do, what progressives sometimes do. This needs to be updated. It's a little bit out of date. I think it's about 3 years old now. But progressives often put up charts like this, showing, well, look, David Cardani was making $22 million in a year, and $85,000 in one day. That's more than most people make in a year. This is just unfair. Let's rail against it. I'm here to tell you, my father passed away several years ago, but he would have looked at these numbers and thought, well, that's because David Cardani, I think the phrase my dad used to use was, he's a job creator. Look at all the jobs he's created. He deserves this money. He worked to get that. Progressives look at that, and it taps into the incredible unfairness of this income and wealth discrepancy. Whereas many conservatives look at that and don't have that reaction at all. And instead, and the word profit is a good thing to them. So I'm not saying don't use memes like this, and I'm not saying don't make these arguments. I'm saying be thoughtful when you do. Be thoughtful when you do. There are some audiences for whom that's perfect. There's some audiences for whom that's going to be actually shooting yourself in the foot. So sanctity. And here's where I think the message is: we need to try to make people that are outside of your tribe also be real. So it's good to have narrative. It's hard to hate somebody you actually know. So it's good to try to make real lives of people who are different. Show how somebody of low income is really, a human being too, who has made life decisions, and you, if you were in their circumstance, you would probably have no choice but to make similar life decisions. So it's not so easy, but trying to show that we're all actually in a broader tribe than our narrow tribe. Authority, well, guess what? You've already got this, whether you want it or not. The day you got accepted to medical school, people were suddenly interested in your opinion on stuff. I mean, at least they happened to me. I mean, nobody ever cared what I thought about anything. And then about a week after I got into med school, people were asking me, well, what team do you support? What music do you like? Which candidate do you like? And nobody had ever asked me that stuff. And suddenly, like overnight, I was like, a lot smarter. People wanted to know what I thought. It actually happened. I didn't understand it, but I thought, well, yeah, they should know what I think. You are an authority, whether you like it or not. The day you got accepted to medical school, your opinion is something that people will respect. So, use that. Use that. Don't bash away. Don't hide away from that. Tell people you're a medical student. When you're speaking in public, don't be ashamed. Be proud of calling yourself Dr. Jamal. Use you're spending a lot of money to get that doctor title. Use it, right? I mean, don't make your friends call you that. Don't make your family. But when you're being introduced, it's perfectly fine to be introduced as Dr. So-and-so, or to be introduced as med student so-and-so, or to declare, I'm a third year med student at such and such. Use that, tap into it. It makes you more persuasive. And if you're speaking someplace where you can bring in more speakers with you, bring in faith leaders. The tremendous majority of them agree with us about most of this stuff. So bring them in. They're very influential, or try to activate them. And loyalty in this context is very similar to what I said before. Try to make communities relevant. But a difference on the loyalty piece that I want to show you is how we can inadvertently threaten loyalty and hurt ourselves. So I'm going to show you one slide that I use when I do my Medicare for All talks, and it's this one. I don't know if you've seen this or not, but already, that life expectancy in the United States is several years shorter than it is elsewhere in the world. I'm sure you know that. This is similar data. This is data looking at our mortality rate by age, stratified again or ranked against 13 peer nations. I don't know if you've seen this. So this is the United States mortality by age, by 5-year age groups, as we rank against 13 peer nations. So all the way out to the left, there's children, and all the way to the right, there's people even older than I am yet. And what you find is that the United States is the worst of 13 peer nations. We have the worst mortality rates by age, or life expectancies, you can think of it as, but we have the worst of 13 nations until the magic happens and we turn 65. And then we climb to the best in the modern world. I don't know if you knew that, but 85-year-olds, 90-year-olds, 95-year-olds abruptly had this increase in our mortality rate ranking compared to other nations. Isn't that sort of interesting? So, I mean, the obvious conclusion to me is that, it's what happens at 65 that's different here than in other countries. Well, it's that we have universal health insurance, really good universal health insurance. So, hooray. But the reason I like to show this slide is because I can also then say, we have much to be proud of in this country. Yeah, there's all kinds of trouble. Life expectancy is being cut 3, 4, 5 years shorter, but we must have many of the world's best doctors and hospitals and nurses and pharma. Many of them must be here in the United States, or we couldn't possibly achieve this turnaround. So you see what I'm doing here. I've presented some really terrible data about mortality rates and life expectancies, but I tried to find a piece of that data that reestablishes pride and patriotism and loyalty. Not always easy to do. So, okay, so I showed you this chart. Here's liberals and conservatives, and then there's one group that when he put out his book, he didn't have data on it because he hadn't recognized that they were different, and that's libertarians. So libertarians have an even different chart on here. Isn't that interesting? So look at that. Their libertarians score like conservatives on caring and fairness, but score like progressives on loyalty, authority, and sanctity. Libertarians score like conservatives on some values and like progressives on other values. That kind of makes a lot of sense. And actually, he's developed other sets of scales for libertarians, which I won't unpack just for time. But he said that they blend these unique pillars. So they're moral pillars. All of their scores on those 5 pillars was lower than on the other groups. So they score low on all of his original moral pillars, but they have their own sense. They are proudly bloodless, and on his new pillars, they score really high on measures of economic liberty and social liberty. Economic liberty and social liberty are where they score higher than the other groups. They tend to be individualistic, which means that they value independence more than they value altruism or patriotism. And I'm going to show you how to kind of try to use these things, but they value independence. If you realize you're talking to a libertarian, don't try to tap into patriotism and altruism. Try to focus on independence as a core value. And one of the ways that this shows up to me is, the cartoon of libertarians is that they're just anti-tax. No taxes. Stop the taxes. Close the IRS. That's the cartoon, and it's not actually what most of them think. Most of them think, of course we need some taxes. Somebody has to, pay for the military. Maybe we don't like a lot of the things the military does, but very few people say there shouldn't be any military, and that's got to be funded by a tax system. Roadways, most people still think there should be publicly funded roads. Not everybody, but most do. Most people still think we should have publicly funded schools and maybe libraries and clean water and sewage collection and stuff. So there's some places for taxes. And the message I try to deliver to libertarians is that, guess what? Healthcare should be one of those. It's a common good, and we're going to come back to that in just a moment. But that taxes should be used for only essential public services, and my point is healthcare should be one of them. The thing that makes it really hard for me to talk to people that identify as libertarian is that they can really kind of take you way down to the bottom of a rabbit hole. And it's, don't expect this to be a 3-minute conversation. They have really, in my experience, really granular cerebral detail at how they get to what they're thinking. And I'm here to tell you that if you kind of take some omeprazole and get down to the bottom of it, you can actually then have a conversation at the center of the onion and come to a common ground and change points of view. So it's worth going down there if you can stomach the ride. So how do we use this in the Medicare for All purpose? First, I was alluding to the idea that they believe there are some places for taxation. And, I would say that the mission is to try to get folks to realize that healthcare is also one of those essential public services that's worthy for taxation. Independence, as I said, well, that's why, we talk about, don't give up your choice, you and your doctor, you and your hospital. That's why Medicare patients love their traditional Medicare. And then lastly, economic liberty. And here's where I go into a little rabbit hole about the free market. The market in healthcare today for physicians has me competing against my colleagues for the most lucrative insurance contract, right? If I can find an insurance contract that's willing to pay me $5 more per office visit, and they say that they can get me 100 patients if I join their network, well then, and I'm already working to capacity, the market today tells me to have my office manager find the insurance product that pays the least and has roughly 100 patients in it, and drop that insurance and move to this new insurance that gets me $5 more. That's what the market is telling me to do as a physician. And if you, as my patient, decide you want to leave my practice for whatever reason, that's nowhere near as much of a business imperative to me as it is for me to get a better insurance contract. That's what the market is today. The market today is physicians competing against physicians for lucrative insurance contracts, and that's not a good use of the market. Instead, if you took out the financial barriers to people seeing physicians, took out the networks, get rid of all that nonsense, and let patients just go to the doctor they want to go to, then my business imperative is to make you want to come see me, to give you the service and the care and the outcomes that you think you want, deserve, and understand and need. So that changes the whole business imperative for what my practice is designed to do. That is a much better use of the market. Instead, today's system has you having to give me up as your doctor because somebody else decided that. That's not a good use of the market. So that's an argument that I try to take when I'm talking to libertarians. Last one of these models is we've been really fortunate that this group called ASO Communications has been giving us specific guidance about communicating about healthcare reform issues like ours, and it's kind of cool. It's headed up by ASO, by Annette Schenker-Osario, and she is, okay, so now we can call her Lakoff 3.0. I had HIDE as 2.0, and I think I might call ASO as 3.0. She studied and worked with Jordan Lakoff, and she's been described as America's most provocative and paradigm-challenging messaging expert. She's kind of the progressive version expert on messaging. Really, really terrific. She wrote a book that I agree with the title of. Don't buy this book. Don't buy it. It's about don't fall for the nonsense, but it's not a great book, and I don't recommend it. On the other hand, she's really well described in this thing called The Persuaders. If you want to read more about her in a book, I would recommend getting this book. There's all kinds of interesting stuff in there. But most of her information is available online. You can get this just from Google ASO Communications or her name, or most of her stuff is available for you. That we're talking about is available there, with some of the stuff that we actually Be a Hero, one of our allied groups, commissioned her to produce for us to get started. So she's done messaging guides on all of these topics. And they're all online. You can look at them. The one on health was kind of limited, frankly, and so Be a Hero got her to do this work for us. And her message is, don't lead with problems. Don't lead with the problem, which is different from what I told you in my public, how to speak in public. She says, don't lead with the problem. And that her message, I think it's in my next slide. Yeah. Americans have 99 problems, and they're not looking for number 100 to complete the set. Americans have 99 problems. So leading with problems, nobody's looking for another problem. She says lead with values instead. And she says when you lead with values, that because of the stuff I showed you from Lakoff and Haidt, most people get crushed. Progressives tromp when we lead in a value-centered debate. And she said that the values that are worth focusing on are these four: family, community, fairness, and freedom. Since she worked with Lakoff, it's not a big surprise that these align pretty well with what he said. So some practical examples. She said, we often use things like this problem, that there's this gap between rich and poor, and it's at a historic level. Look at the wealth disparities. That's a problem that we often, point out and lead with. And she said, instead, to focus on the value, focus on the commonality, on the community. So rather than focusing on the gap, she said you're more effective at building communication understanding to say things like this: no matter our differences, most of us actually want pretty similar things. So we could focus on the gap or focus on, hey, this is one community. We, no matter, if you're not in my tribe, we probably still want the same stuff. So it's a way to kind of pragmatic and make more real some of the messages that I told you before. Really important one that our advocacy community usually gets wrong. I often still get wrong, despite trying really hard to not do it. It's hard to not fix this one. Actually, it's the next one. That's about, sorry. This is the idea of really call out the culprit, describe who does what to whom. That if you want to activate people, it's better if they have a villain to attack, a villain, a cause, a person that's actually doing it. If there's no agent, nobody causing the problem, it's not clear to whom to argue against, to whom you want to address. So she said, in general, when you can, target United, don't target Medicare Advantage writ large. I mean, of course, in policies and stuff, we want to target the whole system. But when you're talking about motivating a group, target a specific insurance company. Pick the CEO of United because he's like low-hanging fruit. He targets himself all the time. So pick specific organizations, specific corporations, and not just privatization in large. And notice she uses the word corporation. As an aside, she said when we call it a health insurance company, the word company is sort of friendly. Mom and pop store, I'm having company over for supper tonight. The word company is a warm, family-centric sort of word. Corporation doesn't have any of those connotations. Corporations is, this steel building of impersonal bureaucracy. So as much as you can, try to shift your language from health insurance company to health insurance corporation. Not easy to do, but something to do. So here's her example of this. She said, we tend to say this: our system is hopelessly fragmented and wasteful. How often have we said that? We say this all the time. Our system is so fragmented. Who's the culprit? Who's the villain? Who did this? Well, so instead, say this: insurance corporations have fragmented our system so that they can funnel staggering sums of money into their own pockets. It's saying the same thing, right? But it's got an agent of action. Insurers have fragmented our system. That's why it's fragmented, and that's true. You're not being hyperbolic. Insurers have fragmented our system so that they can funnel money into their own pockets. And that, I'm sorry, I should have refreshed this more. That takes us to the idea that we don't want to, no, we will get there. I'm sorry. Tangible patient harms, narrow networks take away choices. So replace over-reliance on the macro critiques of MA with very specific things, your narratives. That's where the PNHP harms report from a couple of months ago came in. So rather than talking about the percentage denial rates, have narratives that make it really tangible. And then here's the one I've been trying to get to. I keep thinking it's coming up sooner. Sorry. Don't impugn the good guys. And this is the one that I was saying is really hard to embrace, as much as I think it's really important. So when we say we often unwittingly impugn the government or Medicare without even realizing we're doing it. And then in the next breath, we ask people to trust the government or Medicare to solve the problem. So we focus on Medicare and we don't say the things about the corporations. So here's the way we do that. Here's the thing that's so hard for me not to do. Medicare overpays Medicare Advantage plans. How do you not say that? How do you not say that? What's the other way to say that? She says instead, say that corporations overbill and defraud Medicare. It's so hard to make that switch, but anytime you catch yourself saying Medicare is overpaying Medicare Advantage, put a catch in the back of your head and go, well, that's not the way I want to say it, because that's making Medicare look incompetent. And really, it's that Medicare is under attack by these powerful interests, and we have to rally to support Medicare to make them stronger. So that's a tough one to do. Then lastly, just end with hope, because there's all kinds of reasons to be hopeful. Have we adopted Medicare for all? No, we have not. So maybe it's hopeless. Teddy Roosevelt campaigned on it. So it seems like, oh my God, it's going on forever. Don't use those frames. Focus on, all of the positive milestones. I mean, Medicare itself was an incremental step, and we got that enacted against fierce opposition. There's all kinds of victories that I'm sure you've been hearing about during the internship. So focus on the milestones where we're going, and use the successes that we've been having. So instead of having these deep, if you're giving a presentation and you're doing, half an hour about the predator, half an hour about why things are all wrong, half an hour about there's this problem, there's that problem, there's this third problem, but wait, there's 99 and now number 100 for you. Instead of that, talk more of your time about the vision for how we get there and what it is and what we're trying to accomplish. Talk about the goal, talk more about the roadway and the pathway. So don't ignore the problems, but when you're giving presentations, inspire hope by making the reality together. So this is now 7 years old. I should, but she said this so brilliantly that I'm still quoting her. Amy Evans, she's a physician, I think in Georgia. I only met her the once at this. I gave this talk, a much earlier version of this talk, 7 years ago at a PNHP meeting, and we all had a chance to practice it and broke into small groups. And then they came back and everybody gave like their one sentence that they would use that tries to adopt all of these models that we were rambling about. And so she said that she's going to practice speaking to her Chamber of Commerce where she lives. If she goes to her Chamber of Commerce, how does she open her talk? And she said this. She said, most of you know me as the neighborhood pediatrician. You may not realize I also run a small business. That's her opening to talk to the Chamber of Commerce in her community. Most of you know me as the neighborhood pediatrician. You may not realize I also run a small business. 7 years ago, and I'm still so impressed with how she integrated all of the messages. So look at this. In other words, neighborhood pediatrician, I'm in your tribe, I'm in your neighborhood. She overtly said, I'm the neighborhood XYZ. I'm in your tribe and a business. I run a small business. Again, I'm talking to the Chamber of Commerce. Hey, Chamber of Commerce, I run a business too. Moral pillars, loyalty, I'm in your neighborhood, authority, I'm the pediatrician. Lakoff themes, nurturing pediatricians. I don't know if you've noticed this, but pediatricians have this special genetic production of a pheromone that radiates nurturing. It's something about it, so if you're deciding your career path and you're thinking pediatrics and not pediatrics, get this genetic test for the pheromone secretion of nurturing, and then you belong in pediatrics. It's amazing how well no, I'm kidding. But most people do view pediatricians as very, very nurturing. And so there's that, and hierarchy, pediatrician, physician again. So she tapped into that, and then the ASO themes. You know me as the Navy. She introduced her personal narrative. So she scored like 100. It was pretty impressive. So you can do that too.